and welcome back to DXV today. Now, our next guest is a visionary leader at the forefront of healthcare, leading the development of clinical standards across the city. Recognized for her advocacy of patient-centric care and innovation, she is leveraging telehealth to foster change at the Dubai Health Authority. Please welcome Dr. Khulood Alsayegh to the show. Dr. Khulood, thank you so much for joining us.
Thank you for having me.
So I want to just jump in. As the head of clinical standards and guidelines at Dubai Health Authority, how do you see the role of women in leadership within the healthcare sector? And how do you see it evolving, and what initiatives are you using to help develop that?
Okay. First of all, when we are women, we always think that for our role at home as mothers or as caregivers, and then now we're into the working space where we have to have that balance between working and taking care of our loved ones at home. And if we take that a step further, we're going down the line of leadership. So women having a role in leadership, having her say, having to add value, having to have an impact in society is huge. And having that empathetic values that a woman can hold can make things a little bit different. As my role in leadership, I set up standards in the clinical practice, saying what needs to be done and what doesn't need to be done. And I add my perspective as a woman to this, because some of the standards involve schooling, and I would say, okay, what is needed for school? How can this be interpreted from a family perspective? Some of the standards that I add can into clinical perspective, for example, in clinics, and I would say, okay, the setting would involve pediatric population, or it will involve inclusion population, or it's going to be involving women in particular. What kind of privacy matters are required? What kind of services are needed that support her as a woman? So all of these aspects we take into consideration when we are actually developing our standards.
Khulood, my question to you, since everything is going digital today, my question reflects that a little bit. What is digital health and your expertise of that, plus the role of women in digitization?
Digital health is the transformation of using digital tools to enhance our experience, to save time, to make things easier for us. So in the old days, we would actually go and see a doctor in the clinic. With digitalization tool, I'm able to actually access that care using a device like a phone, and being able to see what book a consultation, see a doctor, be able to get an advice and seek the support that I need, therefore saving a lot of time. The role of women is huge when it comes to digitalization, because it has that extra aid and service that is needed for her in order to support her well-being and support her as a family person. It also saves time in terms of being able not to multitask, but being able to handle multiple things at the same time. I don't like to use the word multitask because we don't normally do a lot of things simultaneously, but if we can have that support for something to be done and delegating it into a system, that can actually help us save time. It can help us manage our time as well. One of the perfect examples was actually focusing mainly on mental health, because the role of women in mental health using digital tools is important, because she'd be able to have that empowerment through a tool and being able to actually support her well-being. Sometimes we think we all need some sort of physical trainer to take care of our physical well-being. We sometimes forget that we actually need a mental trainer to take care of our mental well-being, and being able to have that support, because we actually forget that our roles as women can actually be patient as well. Sometimes we take care of our young ones, we take care of our older ones, we take care of our husbands, we take care of ourselves, we take care of our work. Those multiple things would need that tool to add that value. As well as that, having her perspective as women in the mental challenges are different in respect to men. So having her role in giving what would work for her as a woman using the digital tool would make a huge difference, because I can add aspects to what I think would work for a working woman, a non-working woman, stay-at-home, like a non-working stay-at-home mom, or actually working from home mother. All makes a huge difference.
Dr. Khulood, I wanted to ask you, at the beginning of the show, actually, Amy was talking about representation. And as a female professional in the medical sector, what do you think can be done to improve female representation in healthcare?
I think that's a very good question, Maha. Thank you for mentioning it. I think as time passes by, more and more women are showing up in leadership skills and showing up and presenting their part of the population, presenting women and their background. I think we need to consider them like the way we consider any other aspect of the society. In any representation, we need to have a woman, we need to have men, and we need to have inclusion as well, just to make sure that the society is well representative. I think Dubai Health Authority is doing a great job. There are women in every level of healthcare. There are women, actually the majority of healthcare nurses and physicians are women. In the workspace of the health regulation, there are a lot of women holding great roles and giving great examples for their family, role modeling what they're doing and to the population.
Now, Dr. Khulood, we've talked so much about artificial intelligence, all our viewers on this show, and I obviously want to bring it into the conversation. Is artificial intelligence playing a role in empowering women, and if so, how so?
Artificial intelligence is the new helper, I think, when it comes to women, because it's coming in and there are a lot of ethical implications when bringing it in, because we want to ensure that there's always accountability and there's always safety when we're bringing it in. When it comes to women using this digital tool, how this digital tool is going to support her, how it's going to define her purpose, how it's going to give her that passion to pursue other things that she likes or she wants to do. It also is a way to measure her progress in life. When I have a tool that supports, for example, my well-being, I have more control to see how I'm doing. I have more control to empower myself and being able to self-care for myself and then help others. Having AI as well can help me manage my time, and therefore having that time management can support and give me more time for my family or work balance, in other words. So there are a lot of areas within AI that I think specifically designed to support not just the population, but women in specific. And one example was the mental tool to support her mental well-being, but there are various other examples that I could think of in digitalization, including schooling, for example, workspace balance, physical well-being, and down the line, hopefully, going into the space of a virtual world. How can that enhance her well-being? How can that support her in terms of her emotional overwhelmness that she might be experiencing in her life? How can that support? Absolutely. So there are a lot of areas that we can
so many different avenues, and that's some great advice you've shared with us. Thank you so much for coming on the show, Dr. Khulood, and happy International Women's Day to you.
Thank you so much.
Moving on now, today's spotlight is on a wellness center building awareness by creating engaging yoga retreats, workshops, team building activities and more. This is Gomati Sitaraman from Aroga Yoga.
Hi, I'm Gomati Sitaraman, founder of Aroga Yoga, and where we are very passionate about creating awareness and engagement in the space of health and wellness for individuals and for corporates with restorative yoga, customized nutrition, unconditional laughter, interactive workshops, team building activities, restorative yoga retreats, and much more. Everybody knows knowledge is key, but implementation is the king, because we all want to implement and action our health points. And I would like to bring about consistent and small changes in your life, which you can do it regularly, be it your workplace or your home. Having an opportunity to work with organizations like HSBC and Shambhaji for a 15-minute USP Arogya programs, or conducting laughter yoga for Mondelez, or with interactive workshops with Emirates Fast Food, which is McDonald's. And just recently, we did a team building activity for 400 plus employees with laughter yoga and activities. Everyone knows health is important, but getting people and organizations to prioritize health and to think of it as an investment rather than an expense. Bringing about engagement in the lives of people and reaching a milestone of at least 500,000 by 2026. Dubai is just fantastic. Diversity, infrastructure, and the ease of doing business. Dubai is home to me. I've been here for 26 years. I've watched it grow, connected with this place, and love this place.
Incredible spotlight there, giving some insight into yoga and the world of wellness. It's now time though for the Roundup. Dina, I believe it's with you.
It is indeed. You know, I've got all the news, guys. Well, see, the UAE has announced allocating $5 million to a $50 million fund set up by the World Trade Organization in order to help female entrepreneurs. This was launched ahead of the 13th World Trade Organization Ministerial Conference 2024. The fund is set up to help women in developing countries capture more opportunities offered by the digital economy. Now, I love this because I've already been talking about how women do face quite a bit of discrimination in the workplace. Obviously, we talked about the gender pay gap, and we talked about mothers as well who, I mean, Ash was talking about the interview, which I really related to that. The questions that we get asked that men do not, but also, for instance, imagine your kid actually is sick. You could call into work and be like, hey, I've got to stay home. Yeah. My kid is sick. I'd like my husband to try calling and being like, sorry guys, my kid is sick. What are they going to say? Well, where's the wife? Where's his mom? You know, why can't she stay home? Anyway, back to another discussion. Off on a little rant there. Meha, back to you in the Women's Pavilion, because I absolutely love what you guys do. We've touched upon a few points. What are some of the things you think you guys are planning on doing to help women empowerment, women in the workforce, and we're talking about women entrepreneurs specifically?
Well, that's the whole point with this, with the redevelopment that we've done in creating this incredible space, is because we, like I said, we will focus on uplifting and supporting, but also on empowering. And the co-working space is just the first step, complemented by the daycare, to being able to support female entrepreneurs and freelancers. And there'll be more programming coming up very soon, which I will look forward to sharing with you, but very much focused on empowering.
I think this funding is a fantastic opportunity for women to really seize the digital economy space, because especially in developing countries, I think a lot of the times living in Dubai, we take for granted some of the access that women in other parts of the world do not have. So I believe a fund like this has so many amazing benefits to it. To name a few, providing access to technology, the access is important. Secondly, the digital literacy training. I mean, having the technology is one thing, but learning how to use it is a whole other thing. The mentorship programs, and really having role models, give them the guidance they want to. More than anything else, really advocating policies for gender equality in the digital economy space will help women thrive in this industry, in my opinion. You agree, Amy?
Yeah, definitely. I was just wanting to ask Meha, like, how do you think that this funding will translate? I mean, you touched on it obviously with the Women's Pavilion, but how will it translate into female society within Dubai and hopefully globally as well?
Well, in developing countries, this is one of the things that we actually highlight in our exhibition, in our challenges area, is that unpaid work, and that's when we talk about work to do with taking care of the family, that falls on women, but not only women, but on girls. So it not only impacts women being able to work, but it impacts girls being able to go to school, which then of course has that knock-on effect. So this fund is huge and will have such a massive impact on handling that, especially in developing countries. But just giving women that platform and creating an environment for women to thrive and really achieve their full potential, hearing about funds like this and initiatives like what we're working on with the Women's Pavilion is really the work we need, and a great step forward in the right direction.
Meha, please stick around with us. We're not done with you just yet. It's time for a quick break. Coming up, we are perfecting marketing and communications practices with the Vice President of RM Sotheby's. Plus, Bonnet is bringing a stellar performance with some R&B hits, so don't go anywhere.